Welcome to lesson 6 of CPR first aid with Abhishan. Today we're going to go over fainting, diabetes, and low blood sugar, and stroke. Fainting. What is fainting? So fainting is a short period when someone starts responding for less than a minute and then seems fine. It's caused by not enough blood going to the brain, and seconds before fainting, dizziness occurs. Fainting often occurs when the person stands without moving for a very long time, especially in hot weather, has heart conditions, stands after squatting or bending down. So you know that feeling when you sit down for a while and you stand up and your head maybe starts to fade or goes black for a bit, or when they receive bad news. So steps to responding when they are dizzy: make sure the scene is safe, help the victim lie flat on the floor, and if there's no improvement or stops responding, call 911. And if they faint, what should you do? Ask the person to continue to lie flat on the floor until they can sit up and feel normal. If the person fell, look for injuries caused by the fall, and phone EMS as well. Diabetes. What does it cause? Diabetes is affecting the blood sugar levels in your body. Too much of it or too less of it can cause problems, specifically looking at low blood sugar causing physical harm, use of insulin, where too much can cause low blood sugar. So find one fact about low blood sugar. Can occur when diabetics have not eaten or vomited, have not eaten enough food for their activity levels, and when they have taken too much insulin. Signs include change in behavior, so confusion or irritability, sleepiness, no response, hunger, thirst and weakness, sweating, pale skin color, and a seizure. So how should you treat this? If the person can sit up and swallow, give them something to drink or eat that contains sugar, have them sit quietly or lie down, and call emergency response number. So things to remember. Examples of food for low blood sugar victims: fruit juice, milk, sugar, honey, regular soft drink. Make sure the food has sugar in it, as diet foods do not have sugar and chocolate does not have enough. Stroke. So find one fact about strokes. What are the signs of a stroke? Signs include sudden numbness in major body parts such as your arms, legs, or this one side of your body, sudden confusion and trouble speaking, sudden trouble seeing, sudden trouble walking and loss of balance, sudden severe headache without reason. How do you help someone with a stroke? First of all, always make sure the scene is safe. Phone or ask someone to phone EMS. Note the time where the signs of stroke first appeared. If the person needs CPR, give them CPR. Here's a scenario. A 68-year-old woman patient has sudden onset of left-sided weakness and slurred speech. This 68-year-old patient with a history of hypertension develops a sudden onset of slurred speech while watching television in her home. Her husband recognizes her abnormal speech and asks her what is wrong. He then realizes that her left side of her mouth seems to be drooping slightly when she tries to speak. These are all signs of stroke. Now create a situation in real life representing stroke. And that was all for today's lesson.